Vitamin C and Corona, medical facts. To begin with, it is important to state that no supplement, diet, or lifestyle modification other than physical distancing and proper hygiene can protect one from COVID-19. Vitamin C supplement claims are there on social media that it can help in COVID-19. Researchers are studying the effects of high-dose intravenous vitamin C on the new coronavirus. No supplement, including vitamin C, can prevent or treat COVID-19. Here we can look into what vitamin C is, how it affects immunity, how it's being tried for COVID-19 treatment in a hospital setting, and whether taking an oral supplement is beneficial. Vitamin C is not recommended to treat or prevent COVID-19, but may help to reduce its severity. Vitamin C is an antioxidant, which means that it can fight oxidative damage. When the immune system activates to kill a pathogen, it may also cause oxidative damage. Oxidative stress is viewed as an imbalance between the production of reactive oxygen species, ROS, and their elimination by protective mechanisms, which can lead to chronic inflammation. Inflammatory process induces oxidative stress and reduces cellular antioxidant capacity. Overproduced free radicals react with cell membrane fatty acids and proteins, impairing their function permanently. Vitamin C could fight the damage that the disease-fighting process causes. Further, it aids by supporting the development of white blood cells. In its role as an antioxidant, vitamin C may also help fight inflammation. Inflammation can damage the lungs and other organs. People with severe COVID-19 experience dangerous levels of inflammation. However, very high doses of vitamin C may change the way immune cells die. It may increase the risk of localized inflammation. Adding a steroid treatment to reduce this inflammation is suggested. Vitamin C levels also tend to decline when a person is unwell, but the immune system's need for this vitamin increases. Taking vitamin C supplements can help prevent this depletion. Side effects. Vitamin C causes few side effects, even at high doses. It could be a safer alternative to riskier treatments. Vitamin C has beneficial effects in patients with severe and critical illnesses. It is an antioxidant and free radical scavenger that has anti-inflammatory properties. It influences cellular immunity and vascular integrity. It serves as a cofactor in the generation of endogenous catecholamines. Humans may require more vitamin C in states of oxidative stress. Vitamin C supplementation has been evaluated in numerous disease states. It includes serious infections and sepsis. COVID-19 infection too may cause sepsis and acute respiratory distress syndrome, ARDS. Therefore, potential role of high doses of vitamin C in ameliorating inflammation and vascular injury in patients with COVID-19 is being studied. ARDS, acute respiratory distress syndrome. The oxidative stress from ARDS generates free radicals and cytokines. It leads to cellular malfunction, damage, and organ failure. In such conditions, the use of antioxidative agents in the management is gaining popularity. One such is the use of intravenous high-dose vitamin C. Although vitamin C is known to have antioxidant effects, the implication of its use in ARDS from viral pneumonia is not established. High-dose intravenous vitamin C has been part of treatment for ARDS associated with COVID, but there are no randomized controlled trials or concrete evidence to support its use. Research has indicated that patients with pneumonia and sepsis have low vitamin C status and elevated oxidative stress. Administration of vitamin C to patients with pneumonia can decrease the severity and duration of the disease. Critically ill patients with sepsis require intravenous administration of huge amounts of the vitamin to normalize plasma levels. This intervention, some studies suggest, reduces mortality. Pleiotropic functions. The vitamin has pleiotropic physiological functions, many of which are relevant to COVID-19. Pleiotropic, producing more than one effect, especially having multiple phenotypic expressions. These include its antioxidant, anti-inflammatory, antithrombotic and immunomodulatory functions. Studies indicate low vitamin C status in critically ill patients with COVID-19. There are currently a number of randomized controlled trials, RCTs, registered globally. They are assessing intravenous vitamin C as monotherapy in patients with COVID-19. Hypovitaminosis C and deficiency are common in low-middle income settings. Many of the risk factors for vitamin C deficiency overlap with COVID-19 risk factors. Trials carried out in populations with chronic hypovitaminosis C may show greater efficacy. This is particularly relevant for the global research effort, because COVID-19 is affecting low-middle income countries and low-income groups globally. One small trial from China has finished recently and the findings are currently under peer review. Mortality was decreased in the more severely ill patients who received vitamin C. Due to the excellent safety profile, low cost, and potential for rapid upscaling of production. Administration of vitamin C to patients with hypovitaminosis C and severe respiratory infections, for example, COVID-19, appears warranted. Recommendation for non-critically ill patients with COVID-19. There is insufficient evidence for the COVID-19 treatment guidelines panel to recommend either for or against the use of vitamin C for the treatment of COVID-19 in non-critically ill patients, because patients who are not critically ill with COVID-19 are less likely to experience oxidative stress or severe inflammation. The role of vitamin C in such conditions is unknown. Recommendation for critically ill patients with COVID-19. There is insufficient evidence for the panel to recommend either for or against the use of vitamin C for the treatment of COVID-19 in critically ill patients. Controlled trials. There are no controlled trials that have definitively demonstrated a clinical benefit for vitamin C in critically ill patients with COVID-19. The available observational data are inconclusive. Studies of vitamin C regimens in sepsis patients and ARDS patients have reported variable efficacy and few safety concerns. Ascorbic acid is actively absorbed by the sodium vitamin C cotransporter, SVCT. This active transport is driven by the sodium electrochemical gradient created by sodium-potassium ATPase. In fact, part of the paradox and concern with COVID-19 is that those most at risk mostly have both lower levels of vitamin C before they get sick and fewer transporters to enable the vitamin to be of much benefit, even if they get more of vitamin C. Many of those most at risk from COVID-19, including individuals who are older, Black, male and with chronic medical conditions like osteoarthritis, hypertension and diabetes, tend to have lower levels of vitamin C. Another reason for vitamin C therapy to be considered a reasonable treatment option. The investigators also note that patients may develop a vitamin C deficiency over the course of their COVID-19 illness, because, during an active infection, vitamin C is consumed by the body at a more rapid rate. Insufficient levels can augment the damage done by an overzealous immune response. Reduced transporter levels that occur naturally with age are a factor in the reduced immune function that also typically accompanies aging. That means that even when a 60-year-old and 20-year-old both have a healthy diet in which they consume similar, sufficient amounts of vitamin C, the vitamin is not as effective at boosting the older individual's immune response. Reduced immune function in older individuals is known to put them at increased risk for problems like cancer and COVID-19. Low vitamin C. Low vitamin C levels also have been correlated with higher mortality in older individuals from causes like cardiovascular disease. High oxidative stress, a major factor in conditions like cardiovascular diseases as well as aging and now COVID-19, also is associated with significantly reduced expression of the vitamin C transporter. Taking a lot of vitamin C is a good preventive strategy against COVID-19. Vitamin C is an important nutrient that keeps your immune system functioning properly. According to a report published by the Shanghai Medical Association, High dose for vitamin C may improve lung function in hospitalized people with COVID-19. However, there's no proof that oral vitamin C supplements will help treat or prevent COVID-19. To get plenty of immune-strengthening vitamin C in your diet, make sure you're eating a variety of fruits and vegetables.